All right, welcome everyone. This is the PRISM Celebrating 10 Years webinar. We are so excited you can join us for today's conversation. Just a few housekeeping items. You are all muted. We are, as you just probably heard, recording today's session. And so lines are muted so that we can keep that recording as clean as possible. And we will share this after the webinar today. Please, any comments or questions you may have throughout today's conversation, feel free to throw those in the chat. And again, welcome. PRISM, or the Provider Retention and Information System Management, is a program housed under 3RNet that essentially, and I'm sure I'm gonna put this in the most lay terms possible. It collects data from clinicians participating in incentive programs such as National Health Service Corps, loan repayment programs, the J1 waiver program, and we're really excited to celebrate 10 years of this data being collected by states and shared. And we have a great host of panelists that are going to kind of share with us some information about PRISM. But before we get into that, I want to introduce Tom Morris, who is going to start us off with some welcoming remarks. Tom is the Associate Administrator for Rural Health Policy in the Health Resources and Services Administration of the U.S. Department of Health and Human Services. In this role, Tom oversees the work of the Federal Office of Rural Health Policy, from which he just shared with us he'll never retire. So thank you for that, Tom. The FRHP is charged with advising the HHS Secretary on rural health issues. So thank you again for being here, Tom. And thank you for getting us started with your opening remarks.
Christine, thank you so much for that introduction. It's really great to be able to be with you all today and to celebrate 10 years of PRISM. And just really, my hat is off to all of you for all you've achieved with this. It gave me pause to go back and think a little bit about how we got here. And as I think about the history of what preceded PRISM and the work of 3RNet, it really is intertwined very closely with the work of the Office of Rural Health Policy. You've basically been with us since we first started. I think back to the one thing that has been a constant for this office long before I got here, and it's been a constant for rural health, is the challenge of recruiting and retaining clinicians in rural communities, and I suspect it will always be a challenge. And that's what I think makes this work so significant, is that just watching the evolution of it. And so one of the first partners we ever had to really get at this issue shortly after the office was created was the Rural Recruitment and Retention Network. And then that led to, work with a number of the state offices around a Robert Wood Johnson funded project in the early 1990s called Practice Sites, which did exactly, what you laid out at the top of this webinar about what PRISM was really the vision of what Practice Sites was all about when it was created. I wasn't here, but I remember reading a lot about it. And so it really is quite amazing that we're sitting here so many years later, and we can talk about the evolution of this work and how important it is. It was part of a flurry of activity RWJ funded back then. I was thinking back, I was a newspaper reporter back then in Eastern North Carolina, and they were doing a bunch of work around primary care and trying to grow the workforce. And I remember writing about it. Little did I know 10 or 15 years later, I'd be, involved with it through the Office of Rural Health Policy. And so it's really been nice. By the time I got to FRHP, the work of Practice Sites was well underway and was an important tool for rural communities, and a really valuable one, because I think it provided direct insight that helped people understand what kind of data can we gather to really help inform us to make sure that the clinicians that are recruited, that we understand what their challenges are, that we do what we can to address those. It was a tool to help improve retention, because it's a lot easier to retain a clinician than it is to recruit them. And I think as one of Mike's predecessors at 3RNet, we called it recruitation. And I think that really is the right term when you think about it. You never stop recruiting. And so anytime you can have a tool that helps folks, in that regard, I think is really important. And so, it was important, I think, not only for the clinics that were taking part, but it was also important for researchers because, every now and then, I think we all know this, researchers will drop in and focus on these issues, but they don't do it consistently. So all we end up with are a series of snapshots in the literature. And I think what happened with practice sites and then with the 10 years of PRISM is an annual, continual, consistent, precise way to gather this information from practice clinics and centers and health clinics and rural community health centers, the ability to collect that information, to look at it both at the individual site level, but then also look at it from the national level. It really gives us a much more complete record of what's going on than we would ever get waiting for the individual sort of studies that have typically defined, the level of work in this area. And so, I'm really happy with the way that everything has really evolved. I think it's been really important. The ability to have real-time data about what matters to the clinicians and then be able to act on it is probably one of the most important tools a practice manager can have. And so I really take my hat off to Don Pathman and all the work he's done in the leadership, but really there's so many folks, I probably will run the risk of not mentioning the right folks, but Mike and his leadership with 3RNet, Christine, you and Mark and Jackie, everybody has done a fantastic job of continuing to evolve this. And then none of it really matters, obviously, if we don't have the participation of the practice managers themselves, of the members of 3RNet. It's one of those rare things where everybody pitches in to make the product really valuable and everybody's role is really important. And we couldn't do it without the interlocking pieces of all of them working together. And then to see it move from, originally with the North Carolina Foundation for Health Leadership, it wasn't even the name back then when it first started, and then moved over to the Cecil G. Sheps Center for Health Services Research, and now, has been with 3RNet for a number of years. What's been so great about this is that it has evolved, it has thrived, it has adapted to changing times, and it's still there and it's growing. I think that's the most important thing, is that we see more states joining in and realizing the value and importance of this with each passing year. So we've been happy to provide just really modest financial support because we knew it was a good product. We knew it worked. And so as long as, we have the money and I'm running the office, we're going to continue to support this activity because we really do believe it's one of the most important things we can do. And it keeps us very tied in to the workforce issues that are really essential. So just thank all of you for the work you do on this, but really just appreciate being part of this celebration of what's happened over the years, but particularly the 10 years of this partnership under PRISM. So I'll turn it back to you, Christine.
Thank you so much, Tom. My goodness, it's almost like we scripted that for you, which we did not. Really, really beautifully said. Thank you so much. And it's so encouraging, and what an exciting note to get us started off with, because everything you just said, Tom, we've talked about in planning for this celebration, for this time together, because it is about the data, but to your point, it's about the people. And that's why we thought, let's have a webinar. We can open it up to partners, current users, people who maybe have heard of PRISM or have not, but want to learn more, because it really is about the people, and it would not be possible without, again, to Tom's point, the many, many people who have just fought for and stuck with PRISM and helped it grow and just fostered it throughout all these years. So we'll talk more about the people next, but again, thank you, Tom, for that introduction. Before we continue, I wanted to just take a quick moment to introduce all of our panelists. If you want to just give a quick wave. From the PRISM leadership team, we have Don Pathman, Tom Rauner, Mike Shimmons, and Jackie Fennell. And then we also have two PRISM users, Keith Clark and Mark Overbeck. And we're going to hear from all of these folks sort of in a bit of a timeline setup. So a little bit about the start. Tom already mentioned a little bit about the history. We could do an entire separate webinar on the years prior to the start of this 10 years of PRISM, which we're talking about today. We won't get into that today. But we'll hear from these folks. We'll talk a little bit about the start. We'll talk about the current outputs and growth, and then we'll end with a little bit of the future. So with that, again, circling back to all of the folks, to Tom's point, we could not mention them all. There are so many individuals, organizations, champions of PRISM. We've got some of them up here on the slide. We apologize if we leave anyone out. That's not intentional. If you've had anything to do with PRISM over the years, you know who you are, and thank you for being here, and thank you for all you've done for PRISM. And so enough from me. Now let's hear from the experts who actually know what's behind this great program. And I'm going to kick it off with asking our 3RNet Executive Director, Mike Shimmons, about your start with PRISM. And we're going to start with that because, Mike, when you started in 2012 as a newly hired Executive Director for 3RNet, you were also tasked with being part of PRISM's leadership team. And so can you just walk us through that beginning with both, you know, a new job, but this leadership role and how that kind of started?
Sure, Christina, appreciate the opportunity to kind of talk to everybody today. My history with the program actually dates back to 2006, because that's when I first started working with the Missouri Primary Care Association, and was flown to North Carolina to learn about practice sites, which was then a tracking and matching system that came out of the Robert Wood Johnson's Foundation's work in North Carolina, as Tom was talking about earlier. So many people were working on that in the 90s and grew that program. So by the time I came in 2006, I was learning this software program from a gentleman by the name of Tom Tucker. I want to put his name out there. Tom was instrumental in North Carolina State Office of Rural Health in helping to develop that tracking system. It was a server-based system, and it was a great tool. And in 1998, it was actually integrated with 3RNet. So it started around the early 90s out of that foundation work. It integrated with 3RNet in 1998. And then some additional money from HRSA, I don't know if it's Tom's office or not, but from HRSA was able to make that available to all states. Originally, there was a fee to participate and get practice sites, but after that, it was free. And so it expanded greatly to most of the states. I don't think it ever had all 50 states. So that was kind of the way the product, or what the project was in, let's say, the 2000 to 2000, well, really to 2012. It was still a tracking system when I came on board. And the folks that you're going to talk to next are going to have a lot of information about the actual meeting, kind of got this going. But we had a lot going on in 2012 at 3RNet. We had a change in executive director for the first time in a few years. Tim Skinner and Tom Tucker were actually serving as co-directors when I came on board. And we also had 2 staff people. We had 3 full-time staff people at that time, and 2 were getting ready to retire. So we had a lot of things on our plate that were taking up space. And so when this idea was germinated and approached to 3RNet, we really weren't in a position to take it on as a project at that time. But we were encouraged to join the board, and I thank Maggie Sauer from this Foundation for Health Leadership for that invitation. And it was a great opportunity for me and for 3RNet to kind of learn as it grew, and understand kind of where it happened. And over time, practice sites, their tracking system was, because it was a server-based system, it did go away, and is basically was dissolved, and has now been more and more or less incorporated into 3RNet. And then the PRISM program, as it came out as the retention part, has grown with the name practice sites, and then obviously converted to PRISM. So we'll talk some more about that as we go through this, but it was a time of great change at 3RNet when this idea was coming out. Tom and Don will fill you in more about the roots of this, but I've always been glad to be part of it. It was always a great learning experience for me, and I was very appreciative when the opportunity came around in 2021 to actually move it into 3RNet more completely happened, and that we were able to take that on. So
Yeah,
Yeah,
we'll
it's been
circle back to that in
yeah.
a few slides.
Mhm.
Yeah. Yeah. You mentioned a few key names there,
Mhm.
Tom Tucker, Maggie Sauer, and in you all educating me on all of the details and the storied history of PRISM to get where it is today. I've learned a lot of names, a lot of organizations. I'm curious, Mike, from your perspective, coming in when you did, why was this such a collaborative effort, do you think, from your perspective?
Well, I mean, I'll give credit to Don Pathman and Tom Rauner and others at that time that were really, I think there was already, there's such a collaborative nature in rural health anyway. They were always used to working with each other. And again, from this work out of North Carolina and many other states that participated in this, I think that when some funding came in and offered the opportunity to look about how to do this more consistently or more holistically, the first thing they did was look at each other and other partners. It wasn't like I wanted to take my money and run. It was like, no, let's go ahead and look at different ways we can do this. And again, I give them a lot of credit for that because and the idea of not only just doing it as a one-time thing, but creating a process and a system to develop it.
Yeah, because it was to be one-time funding, right? And they said, nope, how can we leverage this funding into something beyond? And here we are 10 years later, still with that same seed idea. So it is pretty incredible. And thank you, Mike, for that. I'm going to transition us, if I can, to our next slide here. And Tom Rauner, I'm going to ask you, because Mike was just talking about, the idea, and just to give a little context. So this is very much a collaborative thing. PRISM, I mean, collaboration is like the theme of this whole show. And it's so fascinating because, as Mike alluded to, states got this individual funding, and they could have said, hey, we want to just do our little survey or do whatever with this funding they got through ARA, right? Through the, and I'm gonna blank, what does ARA even stand for? But it was the Recovery Act, right? In 2011, 20, am I getting that right? Told you guys I'd get something wrong. Anyway, so they got this one-time funding, and Tom Rauner, at that time, you were the PCO in Nebraska, and you, sir, are a gentleman who loves data. And you could have, I still believe this, you could have said, I love data, I love doing this. You could have just collected the data in Nebraska and gone on your merry way, but you didn't. Instead, you got together with some folks, and we're going to hear next from Don and his broken knee, because that's an anecdote that has to make this webinar. But Tom, could you please walk us through why working together and making this into something bigger than just one time and just your state? Why was that important to you?
Sure. Yeah. Well, I go back to the fact of, I think working with 3RNet all those years before, and what great collaboration we have on recruitment, retention. We'd gone through the process, or at least gone through the process of learning all about the recruitment aspects of it, working with communities out there and what you need to do to make sure you can get somebody. I think the other piece was some of the workforce issues. And we were actually one of the 10 states that was part of the Robert Wood Johnson practice sites. And our mentor state that we had working with us was actually North Carolina. So I got to meet a lot of those folks there, and great folks that we have there. And it was, I guess, really interesting as far as trying to do something. It seemed like with this funding we received, I at least knew from the primary care offices we're getting some funding from HRSA, and was able to get in touch with about 10, 11 other states that hadn't already come up with a plan of how to use the money. I believe it was, like $30,000 a year maybe, and said, well, we could go ahead and, put together some survey tools, get that out there. And I kept thinking, we're all going to be doing the same thing, or at least trying to. And what's going to happen is we're all going to go ahead and put together a different survey tool and not be able to utilize it very well. So I knew Dr. Pathman down there in North Carolina. Don and I had been talking for years on some of the different things with recruitment, retention, different incentive programs. And so what I kind of ended up doing was getting in touch with these states and seeing if they were interested. I first contacted Don and said, hey, don't you have some survey tools? You've been doing this research for years. We could maybe modify them a little bit, make this work for PRISM. And he said he was interested. And we did have a little meeting. I think it was the 3RNet meeting down in Austin, as I recall. And down there were several other states. I think Don will probably bring up who maybe some of those were. And we went ahead and had a meeting with him and said, hey, we'd really like to talk to you face to face to make sure that you understand what we're looking for. And what we were really looking for is just some kind of survey tool we could use. And hopefully, everything about retention is really a longitudinal thing anyway. That's the whole process in doing this. And as Tom Morris had mentioned, some of these things are kind of snapshots that are done out there in time. And I know with the funding, that's the way it kind of works. So we were hoping that we could get something that, if we could get something established in 3 years, then the cost and maintenance of it would be much less. And if we could do it across states, because I know that I don't have, with a couple million people in our state, we're not a state that can actually go ahead and kind of be the beacon of light for everybody. And we all know that states are different and what their structures are and how they work. So we went ahead and said, visited a little bit about this and tried to see if we get something set up. And then I was actually trying to get 3RNet to be the location for this.
Yeah.
And actually, it was something that they were challenged at the time. They were going through the new executive directors, and they recommended the Foundation for Health Leadership and Innovation at that time. They'd been working on some projects. So we needed some place that we could all coordinate through together and collaborate.
Yeah.
And that just seemed to be the easiest process in order to go ahead and do something like this. So yeah, I think that was kind of the biggest key was just trying to go ahead and say, how can we put these dollars together? How can we make them work? I always hoped that we would have something that might allow us for comparability, also something that would allow us something with large enough numbers that we could actually go ahead and make some pretty significant statements with research. And I always loved the data that Don was putting together over the years. It really did help us. I will tell Don, and I have told Don, but one of the issues was when you go with publications of your research papers, sometimes it takes 2, 3, 4 years in feeding it out in bits and pieces. And if there was some way we could help with the collection process of that, we could then actually utilize it, on an ongoing basis and basically immediately with that. So that was how we tried to put this tool together. And I think it's worked out great. We've transitioned over the years into a web-based.
Yes, it's
program.
transitioned a lot over the years. Yes, it's had a lot of.
And not only that, but then we ended up going ahead and getting somebody like Mike Shimmons to go ahead and 3RNet to agree to say, hey, let's take this on. So we finally got the last R in recruitment and retention.
Definitely.
Thanks, Tom.
That's everything. Yeah.
Yes.
Thanks.
And you mentioned a little bit about the data and talked a little bit about Don's work. So Don, I want to hear from you a little bit, because you are a researcher. You've been the researcher when it comes to PRISM data. You're also a physician. And Tom mentioned a little bit about how you were interested in this data, but I'm curious, can you just talk to us a little bit about, from your personal experience, how PRISM has fulfilled both sides of your professional work?
Okay, certainly, Christine, and hello, everyone. Tom, it's great to hear you recounting our history together, because it's been a long road with you and me. Jackie's been there even before that, and then with all the friends I've met over time. So I'll start. So I am a family physician. I just stopped seeing patients a couple of years ago. Now, so I can just have the fun of doing research and working with folks in PRISM and some teaching and mentoring. Great point in my career. But so I want to give a shout out to, I was a National Health Service Corps doc in Eastport, Maine. And I think there are a couple people I saw registered from Eastport Healthcare, which
Cool.
was quite a surprise. And they probably don't know that that they have a direct connection to PRISM, but they do. So it's great to see. So I then was moved down from Maine to North Carolina and have been at UNC for about 15, 20 years when PRISM was starting to come up. And as Tom said, I was primarily doing work looking at hearing from clinicians through surveys to learn what the issues were. And with, I think, the whole field learning that to recruit clinicians is not the same thing as retaining them, and that there's a whole knowledge base there and learning how to retain clinicians. And that's kind of much of my work focused on. And Tom and I, as Tom said, have been meeting at various conferences over for years. And I knew that Tom was loved data and wanted to get it. So I jumped at the opportunity for his idea to take this ERA funding that PCOs received. He got 10 people, 10 states, 11 states together to pool the money and then have a joint questionnaire that went out to satisfy the ERA requirements for some evaluative work for the National Health Service Corps. And I recall so a couple things happened there. One is we'd had a prior study looking at states' loan repayment programs funded by ARC. And so the importance of states programs was key. And what the Corps gave us, I guess it was Becky Spitzko at the time, gave us the permission to include states programs in using the ERA funding to gather information back from states, which I think was really key to building the state focus to PRISM and the collaborative focus with PCOs or workforce offices as heading those initiatives. I think that was really key. And then I see our first year was, I think, really successful together. For those who haven't seen it, I'm looking at it. There's a report that you can still get online, and it's cited not infrequently, called the Findings of the First Year Retention Survey of the Multi-State NHC Retention Collaborative. PRISM was not around yet. We weren't part of practice sites, but you can find that on the 3RNet website. But that's the report that came from that. And it showed the importance of combining states together and then all these disciplines into a kind of comprehensive report, the likes of which really hadn't been done before. And I think it showed the states involved, the importance of working with other states to pool data, as Tom was saying, to better understand. You get the numbers up to be able to compare groups apart. I think it was real important for each state. And I remember the early conversations and the agreements then have held through the time now, which is, do states, are they willing to have their outcomes, their retention data, their satisfaction data compared head to head to other states? And with a lot of trust, which states did not show in 1990 when I started this work, or in 88 when I started this work. All the states held on to their data. And I'm not criticizing, that was just this point then. In fact, states didn't even want data then. It wasn't valued. But documenting outcomes became important over the next 20 years. And then also the importance of, well, let's see how we're doing. Let's compare ourselves to other states. And I think that change in perspective and valuing of data that way was really helped PRISM get off of the ground, and the importance that was there. And I just say, as a researcher coming in, it was, and I approached this, and to get back to your question, Christine, it was really, I would look at the work that I do as an academic researcher as I'm a true family physician researcher.
Mm-hmm.
What's that? That's one who doesn't just want to talk to other doctors, in this case, to other researchers, but once is concerned about the patient, is concerned about the community. So it allows me to contribute my data side and existence and experience to getting data to work with that is in use. And a goal of the PRISM has been to hand the data to states in a way that many states didn't have the ability to be able to manage the data. So that's why there are canned reports that are prepared out there. So there's a dissemination aspect, and hopefully the actionability aspect of it was, if that's a word, was built in from the start.
Yeah, because Don, correct me if I'm wrong, but the states are able to tell, you know, in once they run reports, if a clinician, for example, says, I'm not having the best experience, but maybe they have a couple years left, the state has the discretion to share that, correct? And right, so that, and the idea in that example is we don't have to make a clinician have a bad experience. We can say, hey, what's happening? And maybe have some intervention or some help. Is that a correct or fair example?
Yeah.
I'm sure I'm getting some of it wrong.
So no, you got it right. So the point of PRISM data is not to be an academic exercise. And I will point out that we did not publish anything with the data for PRISM for about the first 5-6 years. Because the idea was to get the data. The idea was to get the data to states so that states could use it. And at that point, publications would have sidetracked us as well, made it seem like we're all about getting the data that we can go publish something. So that only came later. But the idea for is something we have worked on and are still honing now, which is how to make the data most actionable by states. And so part of the data is when clinicians of all disciplines, when they complete the questionnaires for PRISM, they are told that the coordinator for your state, the PCO essentially, will be able to see your responses there, but their employers don't see the so that if there are some issues, then someone who's in recruitment or retention type office in the state can intervene and do it. And Tom has always told stories of looking over clinicians' responses before doing site visits to sites. So that to know what some of the issues.
I want to mention something too quick, Don. I think one of the things that was really nice about this is, again, when we team up with somebody like you as a researcher, when we run reports, we get the data. You can go ahead then, and before we try and go ahead and tell somebody else, this is what the data shows, we can then come back to you and say, hey, can I say this? Is this significant or isn't this significant? And that's a really huge piece to have and share back and forth.
So you know you're putting out the data in the correct way. And I don't want us to get too much into the weeds, but I just so appreciate your personal story, Don, as a physician and, as you said, a family medicine researcher. And I think that's what's so special about PRISM is it is data, right? We're talking about data, but there's such a human element to this, not only with like you all here as panelists participating, but with the clinicians who are saying, you know, I'll work in a high score HPSA, I'll get some loan repayment. That's really great. But let's not just, you know, throw some money at them and then they'll do their service and be done. Let's actually make sure we're taking care of these folks and making, you know, what is their experience? And is it good? Is it bad? What can we do to make sure that, you know, we can continue these programs and continue essentially taking care of? Maybe that's a little too touchy-feely, but that's what it feels like to me when I hear about PRISM, because they're so important, right? At the end of the day, it's about continuing to ensure access to healthcare, and that comes from these clinicians. And so I think that's where PRISM is such a special meeting of the data and the people. And so before we get into hearing from some of the states on how they have used the data, just real quickly, Don, can you tell us about how it all started in Austin, just real quick?
Okay, I thought we were gonna, okay.
You thought you were gonna get a free pass?
It's just, no. It's just a quick story. When Tom approached me and we said, yes, let's see if we can get 10 states to jointly do a 1-year snapshot kind of picture, which then led to the continual one. The planning was to meet in Austin, Texas, for the 3RNet meeting that year in 2011, and it was at the Radisson Hotel and Suites. I just had to double check online to find that out. I was at a point where I was hobbling on crutches for 8 months that year, which was a real problem. But a good side of it is I got in, was given the large suite, a large room at the Radisson, which then accommodated the 10 folks or so there. And the people I can remember, Mary Adamson, I remember from North Dakota, Robert Sewell from Alaska, Jerry was there, Harrison from New Mexico, Hovik Kasrovian from California was there, Jan Hurst from Kentucky was there too. And there was a couple of some folks from Washington State, I'm not sure what else. So it was great. So I got to meet some of these people for the first time. Some had been friends and colleagues for a while. And that's where we got together and people had enough trust to say, sure, let's all do this together. And started it off. And it was, so it's combining an academic with Tom Rauner and his friends.
Good thing you're a social guy, Tom Rauner. Thanks for that. Thank you, Don. I think that I love that story because it feels like such a metaphor for PRISM, right? You had a broken knee, you're on crutches, you're like, no, I'll still go, it'll be fine. And I mean, it's like there could have been so many instances where it's like, nah, we'll just do it a different way. But it didn't happen that way.
The other piece is that Radisson Hotel in my room in particular overlooked the bridge that goes across whatever river that is in Austin, that the bats live under and come out at sunset. And we were all waiting during the meeting for the bats to come out. Of course, they didn't come out. They came out later on, but I'll always think of the bats.
I love it. Shout out to the Radisson. That's so great. Thank you, Don. Thank you. All right. So you mentioned, did I cut you off, Keith? I'm so sorry.
Shout out. I thought you were going to say shout out to the bats, but
the bats. Yes.
Well, one thing that, Don, I'd just like to add to what you said there. One of the things I really appreciate about you being university based, I know the value of information and how hard it must have been as a researcher for you to hold off for 6 years before you would publish anything. But the emphasis was to be a tool, to be able to help the states. And so maybe when I gets to my part of the program.
It is your part, Keith. I was going to say, tell us about how you in Nevada have used this as a tool. How has it benefited your work?
Well, I'll segue just a little bit with what Don provided. And it was during a very difficult time. It was difficult for everyone during COVID, obviously, but our healthcare providers were going through such a terrible time. And I was trying to communicate to various government officials that this really is a problem. We need to be able to get, supplies. We can't leave these people hanging out there. And I just felt very encapsulated, like all of us did, right? Working from home and everything. And then Don put together that study on how people that are on the loan repayment programs were faring through it all. And I was able to get direct quotes from the overall study. And I was able to take that to decision makers and everything and say, this isn't a hoax. This isn't, it was so politicized, but I could say, look, these are people dedicated to helping our people in some very lonely places of our state. And we need to do all that we can to be able to help them. So he discounts that sometimes, but I just wanted to let everyone know that that's a benefit to all of us if we use it, because I view a lot of what we do really is education. Yeah. We're educators. If we want to get the resources we need to be able to educate. And I'll say this, that having worked in the business world, I used to always say to the employees, we're problem solvers. And if we're going to get the business, we got to be better at solving problems than anyone else, because there's people out there with this problem and we can solve it. Well, I'll tell you what, workforce is a major problem. It's really reared its head, hasn't it? And PRISM has been able to give me the opportunity to show how we address that problem with our lawmakers and decision makers. because you really look at the world of workforce, the only thing that's more difficult, has been more difficult than getting a family practitioner to bring his family and move to a frontier community, has been finding data on showing workforce programs that work. You know, one of my other hats is I'm an AHEC director, and so I know that a lot of it's so important that we get to kids early, you know, in these communities, and we do pipeline, but they shut us down to where you only could do 10% of that. And why is that? Because it's been hard to really show that it makes a difference. It's not that it doesn't make a difference, it's just that you can't show that it makes a difference.
Sure. So, you know, not on the AHEC side, but on the loan repayment or workforce side, has PRISM been able to show that difference and share with, allow you to share with lawmakers, stakeholders, what these programs mean to your state in Nevada?
Absolutely. That's the point that I was making, because I can actually take this into our lawmakers and say, okay, we've got a problem to access of care. We have a lot of people in the state that won't accept Medicaid. A lot of doctors won't accept Medicaid. We have communities that won't accept Medicare. They're getting calls all the time from their constituents, right?
Yeah.
So when I can go in there and I can say, look, our loan repayment people that we have contracted, 44% of the money that they receive is from Medicaid. That's their payer mix, 44%. You've got 18% Medicare. You've got 14% uninsured. To have something that solid in a world where there's hardly ever solid information, that really speaks. And so that gives us an opportunity well, it gives us opportunities, because then people start calling you. And like many of you, I can't go testify or anything like that unless I'm invited. Once you start providing information, you find that you are on the invitation list to go to speak to the legislature and things like that. And so I have now our congressional delegation from Nevada often send me emails asking my opinion on things. So I've used it not only for loan repayment, but because I was able to bring something solid in on other workforce issues that they have. They will contact me and ask my opinion. So we have a seat at the table.
Yeah, that's incredible. And I love that in your comments there, Keith, you just added a new side to this human element, which is the patient population, right? I mean, that's really incredible. So thank you for that, Keith Clark. Mark Overbeck, I'd love to hear from you as another user of PRISM. I think you're, if I'm not mistaken, a bit newer in participating in PRISM, but could you tell us how you've been able to use some PRISM data within your state? Similar to Keith, or just like we heard from Keith, rather, what's your experience been like?
You bet. And I will say that, yes, we were a little late to the party in Oregon. I've been in the primary care office.
Never too late to the party, Mark.
Never too late to the party, but I will tell you, because it may be interesting for folks who are considering joining PRISM, like, well, why did we after like 4 years of the collaborative? Well, I think the first thing is I'll say, Tom Rauner just finally wore me down. He was talking to me since 2013. And he was talking to me every year at our meetings together in Rockville, Maryland. But why 2016-17 was really different is we knew we were getting a large infusion of money from our state legislature for recruitment and retention. Like, we knew it was going to be more than $10 million. And now in 2023, it's like $25 million for the biennium we get on our programs. And even though we already had a pretty robust program to track where providers are, we were one of the first states to get that. We thought it would be really useful to get an understanding of the kind of provider data PRISM could offer us, practice sites at the time, from the standpoint of quality improvement and understanding, even back then, 10 years ago or 7 years ago, what's going on in the practice environment. I will say that the last selling point for us to join PRISM was the opportunity to work alongside of Dr. Pathman, who is the preeminent researcher and author and obligated service professionals, with like, I think, over 100 publications to his name. So all of that was how we got there. But to your question,
we do look at those comments that we get from the survey data that say terrible experience, or from a provider, I don't know that I'm going to stay. And we don't always get to the providers, but having that data gives us at least the opportunity to take action, and we often do. You know, there's that that story about the little boy on the beach with like thousands of starfish, and he's throwing this starfish and that starfish back into the ocean. And, you know, we may not be able to get to all tens of thousands of our health professionals in the state, but if we can get to 1 or 10 or 50 obligated service professionals and support them in being able to stay in their community with a better work experience and able to make the contribution that they can, that for us is worth it.
Yeah. And oh, I'm sorry. Go ahead. Continue.
Just really quickly, I think, you know, like he said, workforce is on everyone's tongues right now. So
Yeah.
we need all the tools we can get, and PRISM definitely is a great tool.
Yeah, yeah, it is. And, you know, we've talked a little bit, and I started with the example of, you know, if there is an issue, you know, we can figure it out in that way. And I don't mean to, or I don't want to paint the picture that that's, you know, a great feature. That's certainly helpful. But I think, you know, on the flip side, what's really remarkable, what I've learned over the last few weeks, is just the ability for states to calculate the return on your investment with these programs. And I think in an increasingly expensive world and an increasingly strapped world for resources, for health professionals to be able to say, hey, these programs are working and really giving us a healthcare safety net of access is really, really incredible. And so I want to ask Keith, Mark, one more question to either of you, or maybe both of you, just if you could touch on, because a different aspect of PRISM we've touched on a little bit is you have your data, right, for Nevada, for Oregon, but you're also able to compare your state to the rest of the nation. And I'm curious what that means for you. How does that help you, maybe informing stakeholders or just in your day-to-day work, but just that ability to have, you know, a consistent data set, we're all asking similar questions, and then be able to compare nationally. What does that mean for your programs?
Well, Keith has a much more appropriate size ego than I do. I am from Oregon, so that says a lot. We like to think that we're the best. We know the truth, but we like to talk about like we're the best. We're very innovative. It is actually really helpful for us to be able to do that comparison with the other 30 plus states in the collaborative, to like, okay, how can we stay ahead of the curve? How can we make sure if there's a discrepancy between clinician satisfaction or clinician retention, what do we need to do to change our programs to accommodate that? Is a great question.
Thanks.
Yeah, one of the things I like the data even before it's compared, because it is humbling. It's scary to look at sometimes, but there's also some parts of it I've been surprised of for example, and this gets back to your question about return on investment. When I talked with our state legislators and everything, this has helped get increased funding. I say, do you know that the people that are on our program, that they say they want to stay, you know, average of 15.6 years. Okay, despite all these problems you hear about, once we get them here and we get them in the program, 15.6 years, if you look at the average turnover. But I'm able to go over all the things that we all know as recruiters, the family, the spouse satisfaction, how they're treated in the community. And I'll go back to being the educator again. I use that information when I go to employers, and it's not, I'll use aggregate information. I'm not always coming down on one employer, but one of the reasons we have success, I like to watch that, make sure that our employers recognize that it's an honor to have a Nevada Health Service Corps member there, and there are expectations in the way that you treat them, you know, so I'll look for those. But the biggest thing, it's an education to me, and it's an education to others. Like, this is what we're coming across as in the rural communities. And then I've looked and I like compared us, for example, with the National Health Service Corps, and because we deal with frontier areas, and
Sure.
compared to
Yeah.
Las Vegas. I've recruited for Las Vegas. That's much easier than a place like Eureka, Nevada, you know. But if we can still even hold steady with them, where I think 30% of the people are only in urban areas. I mean, excuse me, in rural areas, I could be wrong, but so you're going to have a different mix. So
Yeah.
that's how I hope that answers the question.
Yes, thank you. Thank you both. And everyone can read these, but I just think it's worth noting quickly some of the really impressive reach with PRISM, the current collaborative. We have 34 states participating. We've, and by we, I mean everyone here, not me, I've done none of this, have questioned or surveyed rather over 26,000 clinicians. That's incredible. 27 SLRP programs, 32 solely state-funded programs. And this is something I know, PRISM and Don, I know you're always so proud of this, that over the years, you've received 68,000 completed questionnaires. You've got quite an impressive response rate. So we are really getting a clear picture. No question there to anyone, just hats off to you all. That's really, really incredible. So moving us forward here in the last 10 minutes or so, new horizons with PRISM. So we've alluded to some of this. We talked about practice sites, which became PRISM. We did that rebrand in 2020. In 2021, PRISM found a new home in 3RNet. We've expanded some educational reach. And Mike, I want to ask you, Mike Shimmons, a little bit, if you kind of told us about the beginning, your perspective at the beginning of PRISM when you started with 3RNet. Can you talk to us a little bit about why it was the right time in 2021 to bring PRISM under 3RNet and what that has meant for both PRISM and 3RNet?
Yeah, I appreciate the question. I think there was lots of things that were happening over the years. So we started being involved with PRISM back in 2012. One I want to bring up is just even the developer of our website, Iowa Computer Gurus, was a great partner, and they of course were also instrumental. They developed the PRISM program as well, backbone. So those having the same developer, and as we continue to evolve in 3RNet and change our website, made a lot of updates to our website over the those 7 or 8 years before 2021. Lots of things had changed. I think it gave us more understanding of what we could do within 3RNet, and also the opportunity just came along. I mean, there was some change in financing there that really affected the program in coming out of North Carolina. We were there and able to look at it. We had also increased our staff. We had 5 full-time staff people by the time we got to 2021. And I think we were just had more capacity, certainly had more capacity, and both through the technology and in staff. And, and the biggest thing with this also, we were able to bring over Jackie Fennell with the program. So I had worked with Jackie, obviously, since the beginning. She and I started right around the same time. And so bringing in a staff person to run the program with the program was absolutely essential.
Bringing in the staff person, the
yes.
one, the only Jackie Fennell, who has been with PRISM since, I mean, all these years. She came in when there were just the first 11 states. We had that word cloud a few slides back, and you may have noticed some state names on there. Those were the initial 11. And Jackie, I want to hear from you, because you are the person doing the day-to-day. You're working with the states. You're really doing all that TA. And what an amazing, comforting person they all have to work with in you. And I'd love for you to just share. I know you love this, so bear with me here. But I know from 11 to 34 states, we've grown. And I think a lot of that has to do with you, just your customer service, your presence, your task mastering and just getting stuff done and being so good to all the states you work with. I'd just love to hear from you, you know, as a chunk of your career, what's it been like to watch PRISM grow over the years and be a part of that growth and behind that growth?
Well, thank you. Now you guys are going to all make me blush here a little bit. So for those of you out there, I'm not the public speaker. Everybody else here is. It's been really exciting to be a part of the project. I think, you know, we've talked a lot about relationships, and for me, that's been the key to this, to my role here, is because I am the person that I work with Dawn in the SHEP Center. I work with all the primary care offices. I work with the programmers. I wanted to give a special shout out to Maria at CHEPS and Mitch at Iowa Computer Gurus. They have also been with us for 10 years, even though they're not here on this panel, they are on the call. So it's just been really rewarding and fun to see it grow. You know, the system's grown and the number of states using it has grown. So I'm really excited to see kind of the next steps of where we go. So I will end my little spiel there and let you all get on with it.
You claim you're not a public speaker, Jackie, but that was lovely. And thank you so much. And I do think you're so instrumental to the warmth and the success of this program. So thank you for being here and for sharing that today. That's great. We've got just a few minutes left. I do want to try to wrap things up, but I want to ask so many questions, you guys. We ran out of time. I think I want Dawn to talk a little bit. So we mentioned the COVID study. Keith Clark mentioned that. Dawn, could you tell us a little bit, because I think this is so impressive how we've done you've done a little bit more. That's probably it's a lot more. I'm sure it's a lot of work gone into this, but the COVID study, the behavioral health study, just kind of working with partners. Can you tell us just real quickly about that? And then we'll talk a little bit more about the future here.
We'll do, Christine. But first of all, one quick aside, which is, I never thought I'd hear friends and colleagues talking about data and the importance of it and get a little tear in my eye. Data doesn't usually bring that in, but you helped me realize we're just talking about providing data and then people using it and finding value in it. And that's what we've been about. And just hearing you just makes me think, hey, you know, we've been successful with this. This is what we tried to do. And you all just paired it back that this is what it worked. So, you know, by golly, it's working. So we are at the point where we mentioned the 68,000 completed questionnaires. So it's, you know, overall, it's something like we're still over like a 65% participation rate. In some questionnaires for many years, it was over 80%. Nobody, I'll point out to everyone, nobody has this kind of data asking clinicians of so many disciplines who are working in so many different types of safety net sites about what their work is like and how they're doing with their patients and what their retention anticipations are and how their families are and such. And the questionnaires were designed to be able to answer various questions there. And it's great, Keith, to hear you talking about the richness of the information and pointing out some of these elements and say, hey, this is, you know, you can take this and use this, because the other side of that is now this data is, no one has this data to answer these kinds of questions. I think, and Tom Morris was talking about some of this to start with. So we should be at the point now where we are looking to analyze the data across states and just to learn more from it. And so I'm within the CCLG SHEP Center for Health Services Research at UNC, and we do have a HRSA-funded health workforce research center under Aaron Freyer, and we do have the only behavioral health workforce research center funded by SAMHSA and HRSA. So we have opportunities to get funding from those. And so we were just now about to submit to Journal of Rural Health a paper that looks at the training of behavioral health professionals and then how that correlates to how successful they are in practice in rural safety net practices. And We have we are now going to start on September 1st, a day or two, on a new study modeling what are the retention factors for behavioral health providers. But we were able to get some HRSA funding through the Behavioral Health or the other workforce center for the COVID study that Mark mentioned. I'm sorry, or maybe it's Keith. Oh. And which I really appreciated that study. So we can do that, but this data is so rich that we can be, well, hopefully we'll be mining that and using UNC resources, other resources going forward.
Thanks, Don. Well, in our last couple slides here, as we near the top of the hour, I know I didn't get to all of my many questions I had for all of you, because it's just a delight to hear about all of the work you've done and continue to do for this. I'm curious, anyone have any closing remarks on what you believe or hope or have a vision for what we can still learn from PRISM? Not everyone at once.
I'll go. Since I guess one of the things I was wanting to mention is the fact that, I'm just so happy that we've finally gotten back to where I thought it should have been in the first place at 3RNet. And the fact that it's on much more stable grounds as far as continuing on. Even though I'm retired, I still enjoy going ahead and being part of this leadership team and being able to have some input on that. And I just hope it, like I said, continues to go on. I know Don, Jackie, and I, for the first 3 years, doing contracts, and we would, I said we'd always be jumping off the cliff and hoping the parachute opened before we hit the ground, that everybody have contracts signed by the end of the year. And now it's much more, less stressful, I should say. So thanks to everyone.
Yeah. Thanks,
Yeah,
Tom.
I think
Go
I just
ahead.
wanted to thank everybody for the partnership, especially over the years, many of the partners we had, but currently the Shep Center, obviously, and Iowa Computer Gurus, Federal Office of Rural Health Policy. Our goal is to continue to grow the program and just make it a better user experience. As we've told you, I think on calls previously, looking to make an update to the system, especially visually, and just the interface with it is hopefully going to be a lot more updated and successfully done. We're also looking forward to doing some more work with that J1 survey, which was just briefly mentioned here. So lots of things coming on the horizon. We're very excited. Again, there's a great legacy to this program, and we feel like we're just holding on to this legacy and trying to grow it and maintain it and sustain it going forward. So thanks for the opportunity here to celebrate. And also thanks, Jackie Fennell, for this great idea to celebrate 10 years of PRISM. Thank you.
You did it. Yes. Thank you all. Thank you, panelists. And for everyone on the call, whether you've been in a position that would bring you here today for 2 days, 2 weeks, 2 decades or more, I hope this fills up your cup a little bit. Sometimes, rural health is not without its challenges. And if you're like me and work at a desk, even though my desk is in a rural community, I can feel a bit removed. And I hope that this conversation from these lovely folks today has made you feel a little more connected to what we're all trying to do, right? The world has some problems. This one is important to us. And as Mike said, the legacy, and I believe the future is full of folks who are determined to work together to continue to make sure we're being thoughtful and good stewards of the resources given to us, so that we take care of those healthcare professionals out there, so they in turn can take care of our moms and dads and neighbors in these rural and underserved communities. So thank you again to Tom Morris for getting us kicked off and for just always being such an amazing champion for us within F4HP. We're so grateful just to him and his support. Please, any questions you have, feel free to put in the chat. We can follow up with you later. If you want to learn more, if you want to get involved, We have a few links here on this last slide. So 3rnet.org/PRISM is our PRISM homepage. And any questions, Jackie's your gal, and she will answer them for you promptly and friendly, because that's just who she is and what she does. Look at that. She already put her email in the chat. Thank you all for joining us. Congratulations to you all on 10 years of PRISM. And here's to many, many more. Take care, everyone, and have a great rest of your day.
Thank you, Christine.
Thank you, Christine,
Bye,
for all
all.
your work.
Thank you, everybody.
All right. Thanks, everybody.